Hi, my name is Kirk Hamilton, and I'm the host of the Staying Healthy Today show. And today's show topic is how to create a plant-based, diet-driven heart disease reversal program in the cardiology setting. I just got finished interviewing a Dr. Kim Williams. He's the chief of cardiology at Rush Medical College in Chicago, Illinois. He is the immediate past president of the American College of Cardiology, almost 50,000 cardiologists. And he is a plant-based physician. He consumes plant-based foods himself. He's a strong believer in it since 2003. He's been on a plant-based diet himself, and he incorporates it with his patients in the cardiology setting. Interestingly, he became open to plant-based nutrition when a fellow cardiologist in the 1980s had said that he had read Dean Ornish's work. He had tried it on his coronary care patients when they came out after myocardial infarctions or heart attacks, and they didn't have any more heart attacks. And so then some years later in 2003, when he had his cholesterol checked and it was very high, the LDL cholesterol, he went on the dietary portfolio, which is a diet by Dr. David Jenkins. It's a plant-based diet, which is rich in plant sterols, fibers, nuts and seeds, and he reduces LDL cholesterol from 170 to 90 in 6 weeks. So since that time, he has reviewed the works of Dr. Caldwell Esselstyn from the Cleveland Clinic and Dr. Dean Ornish from University of California, San Francisco, and he believes very strongly in both those plant-based diets because they've been shown to regress atherosclerosis. They're a little bit different, and this is just his opinion now, is that he would use Dr. Esselstyn's diet for very severe three-vessel disease that needs to be regressed now. It's a little bit more stringent. And then Dr. Ornish's, if we have some time, a couple years, that might be the better diet. And it's not quite as stringent. He, in general, is not a big believer in dietary supplements. He'll use B12. He will use sometimes CoQ10 to reduce statin intolerance, muscle pain. He doesn't believe in fish oils. He feels they have failed to reduce the incidence of MI and recurrent events, and they haven't been shown to prevent arrhythmias. Now, sometimes with high triglycerides, it may be something that is warranted. He does believe in statin drugs. He believes that they have helped and saved lots of money considerably. But again, he does note some side effects, and with plant-based nutrition, you might be able to reduce cholesterol dramatically in and of itself and not need statins. With regards to educating people, he actually, does it himself. He has very long office visits sometimes, and he educates the patient, and he tries to meet them where they are. So, for example, some very health-oriented, educated patients, they can just go on the internet, and he'll take them and show them Dr. Esselstyn's website or Dr. Ornish's website, and they can take off on the program from there. Others, he might do, if they're not as literate, he might just do a substitution of more meat alternatives that are out there, even though they're not optimal. He calls this a transition diet, and he will just ask the person what they eat and then try and find a substitute for that and find it on the internet and show the patient. I'd like to read to you, just at closing, the powerful thing that he said with regards to plant-based nutrition, and I'll read this. And he said, "If I had to get one message across to folks about not letting their culture hold your heart hostage, it really would be to get the understanding, particularly if you are in control of your family's diet. If I could get all of the people in the room to recognize that they are in control of the cardiac events for their entire family when they make shopping and cooking decisions. If we could just get that into the mind of the American people, we could turn this thing around completely." And then in closing, or when he was introduced as the president-elect of the American College of Cardiology, quote, "I didn't get a lot of pushback when I said it publicly at the beginning of my ACC, American College of Cardiology, presidency. Wouldn't it be great if we could eliminate our specialty, cardiology, in a couple of generations?" Pretty powerful. So this interview is packed with lots of information. He goes through, for example, diets. He would use Dr. Esselstyn's strict plant-based diet for aggressive reversal, Dean Ornish's for a little bit more time, and then his opinion, though they've never been studied head to head, the Mediterranean diet is a good diet, but it does not regress atherosclerosis. It may reduce further events 30 to 40%. And so the other two diets are definitely better for atherosclerosis. And atherosclerosis and heart disease is a foodborne illness and can be reversed. So my name is Kirk Hamilton. This is Staying Healthy Today show. Listen to this podcast. Send it to someone you love. I know I say that all the time, but the truth is the information on these podcasts, like this one, are life-saving. And there'll also be links to this podcast and also to Dr. Esselstyn's, so you can see these all together. So until we meet again, talk to you soon. You have a fabulous day.